Hello, everyone. Welcome to Tea with TPS. Our distinguished guest today is Dr. Jacob Eapen, Medical Director, Alameda Health System, and member of the Board of Directors of Washington Hospital, California. I think some explanation is called for here. When you say Washington Hospital, we think of Washington, D.C. How is it that Washington Hospital is in California? I have asked you this question, but I'm sure our viewers may be interested in that. But before that, let me say that you are one of those Indian Americans who have their heart in India. Had it not been for the COVID, maybe I would have seen you at least 10 times more than it has happened. Because before COVID, you used to come every year, not just come and visit, but also you used to contribute to the healthcare in the United States. You used to advise the government, and then you have large contacts here. Any doctor, I say, Jacob Eapen, they know you. Either they were in the school, military school. What's it called? The
Science school.
Science school. Yesterday, only Colonel Brigadier Nair told me that he was your classmate in Science school. So I said, yes, I know that he was. So we say in the United States that the Indians in the US, they have their tan in America, man in India, and dhan in Swiss banks. Is that true of you?
The latter part is not true. I think the first two part is, you're absolutely right. right on the money. But the money is not in Switzerland.
Well, MDs are the moneyed doctors in America. No, nobody wants a PhD in America because they're poor and hungry doctors. So MDs are always very rich. They say, somebody asked, are there poor doctors in America? They said, yes, there are poor doctors who have to wash their Mercedes themselves. That is the kind of poverty that they have, the different kind of poverty. Anyway, but now what we are going to talk about is the big calamity that is facing humanity itself. Nobody knows where we are going. Nobody knows when it will end. Nobody knows what kind of world it will leave behind geopolitically, the population-wise, power-wise, strength of various nations. So there is an absolutely no idea as to how long it will last. And the medical profession, you're all fighting against it in various ways. But every time a new discovery comes, it is worse than before. The second wave has been devastating in India. And now they're talking about a third wave even before we finish the second wave. So what is your overall impression? Are you optimistic that humanity will survive this and sooner than later?
I'm always an optimistic person. If not, I couldn't have worked, in the bushes and the bonies of countries like Tanzania in the late 70s and in Sub-Sahara in North Nigeria, because some of the situations, even before the times of the COVID, were so bad. HIV started in 83, 84. But even before that, there were a lot of, me being a pediatrician and mostly interested in maternal and child health, public health part of it, the infant mortality rates in some of those countries was very high, especially because of malaria and mostly infectious disease. And most of them vaccine preventable illnesses. Measles used to kill, thousands of children. Tetanus neonatorum, which was tetanus in newborns, which has almost got 100% mortality without any life support equipments. So, I've seen it all. So at that time, if I said...
Ebola was a disastrous one.
Ebola was just very, very sporadic. Thank God, during my tenure of 3-4 years in Africa, I didn't really see sporadic in the sense it was kind of concentrated in certain countries. Mostly they had some sporadic cases in Congo. Then mostly it was in West Africa, especially Sierra Leone and countries around that. Nigeria didn't have much of Ebola at all, but there were sporadic cases, yes. But during my tenure there, I don't think I have any direct experience with Ebola.
Right.
So going back on this, now we have got about 154 million people affected with this pandemic, and we have lost about 3.2 million people around the world. Which is not a small numbers. But
Is there any other plague or something which lost more people than this in history?
The Spanish flu of 1918, 1919. I think they had more lives lost at that time for sure. And then there was also a pandemic in late 1500s in the 16th century. So the world has seen similar those things. But now with all these communications and with all record keeping and reporting, numbers are a little more definitely closer to the real reality. I mean, those days I don't know. I mean, even now, as you know, that the reporting is not the best. I'm not even saying that not in developing countries, but even in a developed country like America. There's now a lot of investigation into underreporting of deaths in New York, nursing homes. And pretty much every literature would say that, or pundits would say that reporting even from India, the actual numbers would be maybe about 3 to 5 times higher than what is documented. So, only history will tell you who was right. But there's definitely, reporting, how much ever you try in some of these countries, I mean, a vast country like India, the actual numbers cannot be very factual. It'll be very, very difficult. We don't have that manpower. We don't have that stretch. We don't have the bandwidth to cover all that and investigate all the deaths. But going back on your question, I think we will survive. The globe will survive, but that will only happen if we all participate, we all cooperate, not only as people but even as countries. World Health Organization is there. World Health Organization has to definitely take a leading role. But unfortunately, because of the political situations around the world, World Health Organization had been financially hit because some of the major contributing countries, that temporarily had withdrawn.
They have gone back. US has joined back. No, but bigger than that, in the case of HIV/AIDS, Ebola, etc., the United Nations took the lead. They did not leave it simply to the WHO, because the Security Council, which is responsible for international peace and security, should have taken up this. But unfortunately, since China was involved in a peculiar manner and China was chairing the Security Council that month, they blocked the whole thing. And that is why a global plan to fight the coronavirus was not made. And each country was left to itself. Of course, Mr. Trump had already destroyed multilateralism and globalism. He said, America first. And he didn't want any help from others. He was not willing to give it also. So after the Second World War, there was an architecture of international cooperation, which was shaped by the Americans. UN was entirely an American idea. And then for them to disown it and say that we'll take care of ourselves, you all take care of yourself, and that was a major, major disappointment. And even EU, everybody, Italy was on its own, UK was on its own, everybody was on its own. And is that the reason why the Americans suffered so much?
But going back on
they're scientifically advanced, they have the money, but the worst disaster was in the United States. How do you explain that? Is it only Trump not wearing masks and becoming a super spreader? Or is there something more deep than that?
When countries are, run by populists, in a pandemic like this, I think it is the ripe virgin space for the pandemic to spread. Because decisions are made when the populace makes a decision, they make their own decisions. There's hardly any discussion. it's my way or your way. Yeah. Uh, and scientists were not involved. I mean, this is especially I'm talking about my country here, USA. There was so many scientists, panels of scientists who were discussed and who had advocated many things in the beginning of the pandemic, and nothing was heard. And if you look at other countries, which were run by populists, Brazil, that Bolsonaro, the president, he cannot be another. You know, I don't think anyone can replace him because same thing. I mean, he was all doing on his own way. And what happened in Brazil? I mean, Brazil had, one of the worst hit countries in the world, and they also have their own mutations too. Then, if you look at Mexico, same thing. Manuel Lopez, another populist, he did things on his own, and one of the highest death rates from this pandemic in the world was Mexico.
So now that same charge is being made against Prime Minister Narendra Modi.
Well, under the panel of populists, I think the Indian Prime Minister comes in too, whether we like it or not. And actually, the four countries they discuss is one is Brazil, one is Mexico, one is India, and the other one is Philippines. Duterte in Philippines, the president, he's also a kind of a one-man kind of show running the whole thing. So Philippines was not spared from this pandemic. So I think, this is why I was saying in the beginning. I mean, you need a cooperation between there should be a political will, there should be a will from the scientists, there should be will from the people. And we all have to unite with them. I mean, this is a war, and the war is against the virus. And if the opponents are not, tied up together, and if they have got their own opinion, this is not going to work. So the only hope is that the leaders will have to believe in science, follow the science, follow the advice, and move forward, because that's the best guess we could do.
Right. But this is the biggest surprise of this pandemic. That is, the richest countries or richer countries have suffered more than the poorer countries. Maybe in poorer countries, the statistics are not available. Maybe more people are suffering. But if you look at the highest tragedies, they're all in the developed countries, Europe, Latin America. Of course, Bolsonaro has survived, but he was known as the Latin American Trump. He was very proud of that. And now he is talking about also preventing forest fires and all that. So he seems to have come back to some senses. But this is an irony of history that these rich countries who are capable of not only helping themselves, but also others, failed miserably.
Yeah, very true. I think when this whole pandemic started, I think it started off, mainly the outbreak started off in Italy, northern Italy. And the reason for that, what historians say,
Chinese travelers, right?
Is more, there were a lot of textile industries in northern Italy, where the workers were mostly from the Wuhan province around that area, and so the spread really took off in northern in Italy, and plus the demographics of northern Italy is that they had very older population. So that was a ripe place for the pandemic. So Italy, and what happened is some of these countries that got hit, then France, then of course New York, via England, and when I should say when even the medical community was not really very well prepared for this kind of pandemic. So the same lives that were being lost a year ago, with the same symptoms, with the same severity, are they losing now? I don't think so. So the mortality has definitely decreased because the doctors, the scientists, they have learned to deal with these in a much better way. Because in the beginning, it was all panic. It was all shot in the dark. People were trying all different things what they thought might work. But those stages.
Has President Biden made a difference? He's claiming that after he became president, he dealt with this issue in a decisive manner and therefore he was successful in containing it. Do you agree?
I definitely should give credit to him in this vaccination uptake. I think if not for him, if it was a previous president, I don't think the vaccination uptake would have gone up this much for sure, because there was so much of apathy, not only from him and from his, there was a party division in this. Unfortunately, when pandemic gets divided by party line, it's very very unfortunate. And so uh, I don't think the uptake of vaccine that we are seeing in this country right now, definitely you wouldn't have seen it before. Right now, about 40% of, or maybe a little more than 40% of the people in the US are vaccinated. And we in the last 2 weeks, actually, the vaccination rate has slightly dipped. That's because there is definitely an hesitancy among a certain population. The latest number that I saw was last month. There were 29% of the people said, "No, I won't have the vaccination" in March. And the latest report in April is that has come down to 20%. Which is very gratifying. And today is also there's a report that there are more Republicans who are willing to take the vaccine or accept the vaccine. Having said that,
that is more important. But
yeah, so
yeah, go ahead. Go ahead.
having said that, there are countries who have done even much better. I mean, Israel has vaccinated more than 62% of the people. UK has done a pretty good job, 50%. So, but then I should also bring in countries like India, where our vaccination is still running at less than 2%.
Because our 2% is a huge number of people. That is the problem. But here I want to ask you this question. When the United States was in its worst shape at that time, there's a lot of sympathy for United States in India, our close relationship, the common values, and even things that may not have been very effective. The medicines we exported, whatever they wanted, we gave them, and so on. More than anything else, there was a tremendous amount of sympathy. But now we don't see that. When India is in a worse shape, you find more criticism and more "I told you" kind of statements coming. Is there any particular reason for it?
I think I would like to divide this answer into two. One is a political, one is a non-political. I mean, on the political level, they it's really hard to say. It was very well reciprocated. The aids and the help. But on a non-political level, I think there has been tremendous support, from the community, not only the Indian communities here, but even non-Indian communities. There's not a day that a non-Indian would see me on the street and ask me, Dr. Eapen, how are things back in India? How are things back home? And so there's definitely an empathy and compassion among people. But when it comes into major decisions where politics is involved, then it's different ballgame. But then
No, what I'm referring to is, suppose there was a criticism on the US, and we had said that US is now not democratic enough. We would never have said that. But now, when you read the newspapers and commentaries in the US and other countries, they are saying that India has become a dictatorship. They have downgraded our democracy to half democracy. They say it is an elected autocracy, etc. So, why is it that happening? Why is it that they are not thinking in terms of the survival of the people rather than criticizing? Of course, our people also criticize, saying that Modi is responsible for all this. Why did he export all that vaccines without knowing that it was necessary for our people? But the criticism is much more than what we would see. This is like the Article 370 or the citizenship issue. Like that, there is a tremendous, what shall we say, outpouring of not sympathy but of viciousness, saying that, this is happening because of Mr. Modi, etc. So this is very sad. We would have expected them to say, even if they didn't give us anything. And also Mr. Biden's first reaction, I cannot give you raw material for vaccines because there is a law which prohibits me from giving it to you. Even today, he has not given. He has only given us some machinery and equipment and gloves and so on. But the real vaccine material that we want, they have not given it yet.
Yeah, so but as we speak right now, the intellectual property, rights for the vaccines have been lifted. It's been lifted. It's already been waived.
So it will be much against the wishes of the industrialists in the United States, right?
That's right. So there is, you have to look at, I mean, there's no probably, a reason to point fingers at the president, when there's so much of lobbying, as you know that. I mean, pharmaceutical industry is one of the biggest lobbying forces in this country. So, to crack them and to make a decision, it's not easy. So there must have been some lag period. I think I would give him the benefit of doubt and say, because even during his election campaign, this is one of the things that he said. There is a pandemic, and if you have got to go out and help people, lift the licenses, temporarily, we'll have to do it. So he'll have to keep by that mandate. And I don't think personally he had any issue. But then, the problem with all this is also there's some egos, and we'll have to lift the egos. I mean, especially when you're a leader. I know incidences here where, very renowned Indian doctors who were very specialized in this, virologists, people in the emergency care who take care of these patients, thousands of patients who have offered help to India and asked them to temporarily lift all the restrictions for the doctors to help both on telemedicine and people ready to come there and volunteer themselves. And that has not been approved as yet. And, it's on both sides. But what I'm saying is we got to completely clear all these egos, and otherwise this virus is going to be around us for a very long time. And as you know, that reminds me, a quote from the Bible. When two or three, Jesus said, when two or three people are there in my name, I'll be there. So in the same way, when there are more than two or three people, in your name, I think the coronavirus will be there. It loves crowded places. That's why the outbreaks are much more in marriages. Outbreaks are much more higher in birthday parties. It's much more higher in funerals.
And elections, of course.
Yeah. So, yeah.
Yeah. So the second surprise of the pandemic was the Chinese action. What were the Chinese trying to do? They thought that America is going to disappear or becoming a second-class state, and therefore they were wanting to fill that gap, the vacuum. And that was the only explanation given for their very aggressive posture soon after the virus broke out, because he, invaded India. He flexed his muscles in Taiwan, in Hong Kong, in South China Sea. So when somebody should be sitting and helping people out in this situation, particularly when they have been accused of creating the virus in the first place, that has not been proved otherwise. So then, for them to look at this as an opportunity to conquer the world, as it were, and that was most surprising.
Yeah, in this world, especially among leading nations, there is always kind of a you can call it as a Cold War, and it's a competition kind of thing. So, and if there is a bio warfare in this, they'll countries will try to look after themselves and be the winner. Unfortunately, that's what I was saying. Unless there is a cooperation from the community, from the people, and everyone who's involved, it'll be very, very difficult to tackle this. Because even if there's a pocket, even if you eradicate or try to minimize the infectious rate all around the world, even if there's a pocket in China, that is all you need for the virus to come back. Because wherever there is a spread, you should realize that mutations can happen every day.
Right. Anyway, let us come to the vaccine story. It's all very confused. We don't even know who found the vaccine first, whether the Chinese or the Russians or Americans. Do you have any guess as to who created the vaccine first?
See, again, you'll have to take some other reports coming from some other countries with a pinch of salt. I mean, especially news coming out of reports coming out of China, or news and reports coming out of Russia. I don't think you can take it like you can compare like apples to apples. You can't you'll have to take it with a pinch of salt. So I think the first country that announced a vaccine for this was China, and pretty
Yes.
close. Russia came out with Sputnik, and so I think those were the two countries. But again, there was no report on any trials. There was nothing about phase one, phase two, phase three trials. The scientific community was definitely not ready to accept these vaccines unless they had seen something on a scientific manner.
So
So
unfortunately, there was no consortium. There should have been a global consortium which should have worked on the vaccines. Then there would have been no competition. It's generally owned by these countries. That would have been better. But for the reasons that I outlined earlier, that was not possible because the world was completely divided. But now, do you think there is a tendency for people to cooperate? Has that changed after President Biden came? Because he's thinking of his allies, he's thinking of his friends, and therefore there is a greater cooperation possible, you think?
I think so. I think the political climate here has definitely changed. I think for the better, uh, especially to tackle something like a pandemic. Uh, because there is more respect for the scientists, more respect for the advices of doctors. There are listening ears, in the cabinet, in the White House. So all that helps for sure. Yes. So for them, then the decision making also is much easier.
Right. But you have the best virologist in the world, Mr. Fauci. Nobody seems to be listening to him, even now. Of course, nobody listened to him when President Trump was around. But the vaccine has to do much more, don't you think? Because it is still not foolproof.
Uh, so there are two vaccines, actually three vaccines now that's being given in this country. We started off with Moderna and Pfizer.
Mm.
Pfizer based out of Massachusetts, and Moderna, which was between a company in Germany and the US US company. So both those vaccines were the ones that we started off with. Since then, Johnson and Johnson was cleared, a single dose vaccine,
Yes.
and no other vaccines have been cleared.
Yeah, we have Seneca, which is British, but we also have India's own Covaxin, don't we?
That's right. I mean, AstraZeneca. It's kind of interesting. I mean, although it is an AstraZeneca, it's a mutual this thing with Oxford University, developed yeah, US and actually invested about I think 1.2 billion dollars in AstraZeneca because one credit I should give it to the previous administration is they definitely developed something called Warp Speed. It was a private public entity mainly to develop vaccine as soon as possible, uh, to manufacture as soon as possible, and roll out delivery mechanism as soon as possible. So that initiative, I think, was very good because it's the only reason why I think the world was able to have a vaccine in about 10 months. The closest in historically, if you look at vaccine development, um, I think um,
This was the
Mount
fastest.
Rubella vaccine was the shortest, which was 5 years. On an average, others is about 10 years. So, these two companies, I think we got to completely, definitely give them credit. And, and pretty the efficacy level is pretty high and pretty effective. So, all the mutations that that we have been recorded so far, they found that these vaccines still cover them. Maybe not to the full effect, but definitely to prevent them from severe infection and hospitalization.
Yes, and now there is greater faith in all this. Even in India, there was some hesitancy initially, particularly about the Covaxin. The Congress party took a line that this has not been tested. They politicized it. But now everybody wants Covaxin, not Covishield, because Covaxin is supposed to be more effective. But all these are not known very clearly how long. So everybody is looking for something which is foolproof and something which will guarantee non-infection. And that I think is still some time away. I think.
Yeah. I think the only way this will work because of the mutation. Any virus mutates. That's very normal. But if the mutation is significant enough to evade the vaccine immunity, then that becomes an issue. So I think what's moving forward, what's going to happen is, these two vaccines, Pfizer and Moderna, were actually by a technology called messenger RNA, which is much faster and easier to develop. And so even a little bit of tweaking around these, once you have the platform, it's a little more easier. So what I visualize is, pretty soon we might have, booster doses, which would be more effective for some of these variants. And in fact, Moderna has already today morning declared that they're doing a study to come out with a booster, which will be probably more effective for most of these variants.
Yeah, but you'll have to keep up with it because it keeps changing, and therefore you have to keep on. Anyway, let's come back to the situation in India. Now it looks totally hopeless, the kind of situation that we are facing today. Numbers are increasing astronomically. None of us thought, not certainly the Prime Minister. And so he was gifting away our capacity, our vaccines, in the name of vaccine Maitri. I never believed in it. I used to tweet at that time that this is wrong. We need to conserve this for us. We have no idea how it is going to infect us. And then, my own colleagues in the Foreign Office said, you have to give, then only you can get, and all kinds of theories. And what probably prompted them was the fact that China was doing this. China was distributing vaccines to developing countries. And we felt that we must also do some kind of what is called a soft power diplomacy. And this was, I know it from my own colleagues who run the show now, that they were very sure about that if we distribute it, we will get. But what happened was that we gave away our assets. And now we are begging, literally, for the same things that we gave it away. How did we do such a foolish thing?
I think there are a few reasons why I think, the pandemic has really hit India badly. You can always blame it on this newer mutations to an extent, which nobody knows if that is the only cause. But the second was planning. I think the planning.
Yes, why not have oxygen? That's nothing to do with mutation. We don't have oxygen. That is the basic thing that they should have conserved. And it was not so difficult to manufacture or store or anything like that. So, but to hospitals, we can understand, it's overwhelmed by the numbers. But what was the problem with oxygen? And now oxygen is being sold in the black market. All the evils of mankind have come into this. And you can buy beds, by paying a huge amount of money. So it's pathetic, the situation.
Yeah, it's so unfortunate. A large country like India, we would have thought that there is, sufficient oxygen plants and things like that. But when even basic necessity like oxygen is not there, and the Wall Street Journal or New York Times, the front page writes, India running out of oxygen. It's actually a shame. It's not in a very great situation for Indian. Indian loving NRI sitting here and reading all this. But
what is the difference when people ask you, what do you say? Because for them, for an Indian American, the first Indian they see, they ask you all these questions.
Yeah, so, on this vaccine export or giving it away, I don't know, whatever. I was pretty much against it. Even at that time, I have discussed with many of my friends. Do we have enough to give away like this? We are a large country, but I think the notion was, somehow, we are not going to be touched by, Corona or COVID-19 as much as other countries, and we were some way more immune. I have no idea what the thinking was, because we do have a health minister.
India is the pharmacy of the world. And that theory we had till the Chinese incursion took place, because when we wanted to punish China economically, we tried to cut off some of the supply chains from the United States. And we found that the worst thing that would be affected was the pharmaceutical industry. 60 to 70% of our entire pharmaceutical industry is dependent on China. And therefore, the government of India quickly changed that attitude and started ordering and so on. But the one thing that I feel, that if the Chinese had actually made this virus, probably they have the best antidote for it. So Chinese should be producing the virus, but they won't say that, because then immediately they will be accused of having created the virus. But that is, by the way, it's in lighter way. Obviously, they have not they have not created it, but it may have happened by accident or whatever. But they
No,
have not. But they don't
yeah, people.
regret it.
People ask me that, where did it start? How did it start? There's a lot of conspiracy theories, but whenever something like this happens, there'll be always conspiracy theories. This is not the first time. When HIV started, there were so many conspiracy theories on HIV. But I tell people, I said, look, I'm a physician, I'm a public health physician. When I'm faced with something like this, I don't care how it started. But now, right now, my role is to stop the spread as much as I can and contain the spread as much as I can.
That is
Uh,
true, but the source is important, no? The source will show some
I mean,
indication.
they think that it came from kind of a meat stall in Wuhan and things like that. But whether
Right.
it was artificially made or man-made, uh, there's what I'm saying is there's not much point in wasting too much time on that.
No, but there's a Nobel Prize winner who said that this has to be man-made, because if it was not man-made, it would not have spread to so many countries. If it was a natural virus, it would have stayed only in certain areas. And he said, if anybody can prove this is wrong, you can take away my Nobel Prize, he said. So what do you say to that?
I think I'll stay away from that debate because it's so difficult.
Doesn't help.
To call that, because if I say that and then 5 years from now, if they found out it was a natural infection, then I don't want you to be calling back and asking.
No,
So
that is like astrologers. We never check back. If he says that world will end in 2025, we don't find him to check with him why the hell did he say that. So he can easily make predictions and get away with it. But let us come to our own hometown. Kerala initially got a big applause from the rest of the world. 30 foreign publications featured our Shailaja teacher as the savior of the world and the people, and so on and so on. There are two opinions. One, that it was very successful. Other was that this was public relations. We were spending a lot of money producing all this and paying to the journalists, etc. But genuinely, we felt that we made a big contribution, because there was Nipah before that, the floods, all that this government handled with a certain amount of seriousness and success. Of course, money may have been stolen and taken away. That's a different story. That everybody does, it seems. But at least there was a certain amount of sense of purpose in this, particularly in the health minister. And it looked as though we had won the war. But now look at it. Nothing that seems to work. Now we are going to start day after tomorrow a complete lockdown, which we were discouraging, because if you have a complete lockdown, because there will be poverty, there will be problems of people not having anything to eat. So, and the rate at which it is going, it is almost as high as in Delhi. So, what is Kerala's problem now? We had all these primary health centers, and we had a fairly good. You should know Kerala's organizational structure. But why is it that we seem to have lost it at this time?
I think I was there as late as last February. I mean, just 3 months ago, when everything was going on, but not as bad as now. I talked to several of my friends, and I said it is too early to applaud and say that we did a good job. Because in the US we already had 4 waves, and you have had only 1 wave, so it has to be there. It has to come, and by then the mutations started. But then if Kerala is very close to my heart. And Kerala used to be one of the 7 countries of, I mean, it's not a separate country, but they always used to talk about the healthcare miracles. Those days it was Sri Lanka, Costa Rica, Cuba, even China with food doctors. So but I think those have changed. I mean, our public health system is not the same that it was, I think, in the 70s, and maybe even 60s. I mean, even if you look at mosquito eradications and things like that, when I was a student there and when I used to sit outside, in my house, I used to see this from, people from, corporation who comes to, spray this. Yeah, you don't see all that now. Absolutely. I mean, I've been the last 20 years, I don't think I've even a single guy coming and doing it. So
we are supposed to have eliminated malaria, for example, completely at one stage, right?
I mean, Kerala fortunately didn't have, real outbreaks of malaria compared to northern part of India or northeastern part of India. Punjab, always there's endemic in northeast Delhi, but Kerala, I don't know, somehow we kind of got away with it. But there are a lot of other, infectious diseases that can be spread through mosquitoes. I mean, the other mosquito, Culex, we all know that spreads, filaria, which is pretty rampant in the central part of Kerala, Alapi, Charthala area. So there are mosquitoes can spread a lot of infection. So, but I was looking at some of the success stories in this pandemic. If you look at Taiwan, Taiwan, had an outbreak to start with. They were affected. They were so close to mainland China, and but in spite of all that, they had only 11 deaths total. In the last 16 months. Vietnam,
New Zealand also, and the common thing is both of them had lady heads of state. that is the logic given, that whichever country is headed by a lady, they have done better than those who are headed by men. I don't know whether this is true, but certainly in New Zealand and Taiwan, this is true. Maybe they had a more kind. Even our own health minister is a lady, and so maybe there is more sympathy and more understanding. Anyway, but these are all legends. These are not true. But but the Kerala system. Is there something then you can suggest they can do now?
What I was saying was the other country that did very well, not too far from there, was Vietnam. Vietnam, with a pretty good population, they were able to contain this very well. And I was trying to, investigate and study a little more how they did that, and they all attributed that to their good public health system. They had the tertiary center, they had the secondary centers, they had the primary care centers. The distributions went on, very smoothly. Procurement was all by the central thing, and then distributed to all around, even to the primary care level. So I think there is some lessons to be learned, from some, we don't have to compare with a, developed country who spent probably, millions of dollars to achieve this, but we can look at Vietnam and, learn a lot from it. So I think in Kerala, I think what we should do right now is, I mean, again, getting vaccine, it's so confusing. Nobody knows, where does the state get from? I don't know where the state gets. I was under the understanding that the state gets all this supply from central government, or the Ministry of Health Department from the central government. But now I'm reading that procurement can be made directly by states by negotiating with manufacturers.
No, that is because they're desperate. They would have liked to control all this. But now the question is how to deal with the situation. And so they are saying go and buy. But when you go and buy, they say it will come in June or July. By then, many people would have died. And therefore, whether this formula of allowing people to buy from the market, whether it will succeed or not, I don't know.
I mean, for something like vaccinations like this, we'll have to somehow find a way to give it free. I
Yes.
mean, that is the only way we can increase the access. Because every time you do something like this, or you got to be above 65, or you got to be born on a Monday to get the vaccine, or so these are all the barriers that we put in. And in a campaign like vaccination, if you put barriers, it's not going to be a very successful operation. I can tell you a typical example in my county public health system. I'm the medical director, but some of the decisions are made much on higher level. Patients, we started off by saying above 65, then 45, and there was a clause in that, that not only the patient has to be our patient, but has to be seen by a doctor in the last 1 year, and classify that as an active patient. If you're not seeing a doctor in the last 1 year, uh, you cannot give the vaccination unless you're seen by a doctor. I mean, I thought that is such a stupid this thing, because I mean, if people need to get vaccinated, somebody must have been healthy. So I didn't see a doctor for 1 year. Why should I be crucified for that? You know.
Right,
So
right.
so, what I'm saying is, we can bring in all these hurdles. Mostly it is from bureaucracy. Some of them are from ego. But I think we should forget about all that and somehow try to put as many vaccines. Whoever is ready to roll up their sleeves and come. Well, that's what I would say. Just go ahead and give it. No questions asked. I
Okay.
mean,
Anyway, one good thing that happened to the government, the present government, Mr. Pinarayi Vijayan's government, was their performance, at least the way they were seen, they got continuation of the government. And I think the pestilence, COVID-19, played a role to give them a kind of effectiveness, and it was recognized in spite of the fact that people were accusing them of all kinds of scams and scandals and all that. People didn't bother. They said, what we need is food in the plate, and that is what we need. And this government gave the impression, I don't know whether it's entirely true, that they took care of the poor people, they served them food, nobody starved, and that got uh, some applause, and that is probably the reason why they were able to win so impressively now. Do you agree?
I think so. I mean, definitely there was a mandate. I mean, in a democratic system, I think it's people's power, and if people think that the government has done a good job, they get re-elected. So definitely there must have been something that pleased their eyes and pleased their ears. But having said that, we are still doing pretty poorly in the positivity rate. I think today morning, Kerala has reported in the last 24 hours about 42,000 cases.
Right.
Over India, it's about 400,000, 450,000. So almost 10% of the cases are coming out of Kerala. And, unfortunately, there are about 24 states that positivity is more than 15% in India, and about 10
Right.
states running around 25. And, Kerala, Karnataka, Maharashtra, UP, they four of them contribute to about 75% of the positivity rate in India right now. So there's nothing much to be cheered about. And and one of the I think things that Kerala probably did wrong was also in the testing. I think the yeah, the
Mm.
testing of the testing rates were very, very slow last year, even when the pandemic took off. We started off with a good job. We started off by um, you know uh, uh, identifying the case index, and tracing them, following that. This was a big story on this somebody who came from Kuwait or somewhere, and then went to Rani and Koni, and they were tracked down.
Yes.
That was just
Even a 92-year-old man was saved who
yeah.
came
So
from Italy.
that was one case study, and then that stopped, and
Yeah.
everything was published, and that was just one case study. So I think we did a poor job in contact tracing and testing, and isolating people. And there was definitely some kind of a lethargy and complacency in all this. We are a good state, we are a clean state, we are educated, we know what you're doing. No, it doesn't work that way. I mean, it's unfortunately that cases have really gone up. But only silver lining in this is, though Kerala has had about 20 million, infected cases, fortunately, I mean, again, I won't say every life is important, but if you look at the mortality rate, loss of life has been around 5,450. If you compare the neighboring state, Karnataka, which has had about the same number of cases, about 20 million positive cases, their death rate has been about 16,250, which is about more than 3 times more.
Right.
And
that doesn't give us any solace. Anyway, we have run out of our time. So let me ask you the personal question I started with. You were elected to the Washington Hospital as a board of directors 5 times. Was it a political election? I've been hearing about it. How did it work? First of all, why Washington in California?
Well, this is named after a historian who was here, a long time ago, a community leader, in this area. So it was named after him.
It's not George Washington.
No, not at all. And this is a community hospital. The hospital actually was started by about 4 or 5 people joining together and donating the space, and that's how the community hospital started. But now I think I'm proud to say that now by USA News and World Report, Washington Hospital is ranked in the top 100 best hospitals in the country. Not in California, in all of America. So we are there.
Your election to the board was political election, was it? Are you a Democrat or a Republican or something?
It's supposed to be a I'm in the ballot. The first time I ran, I was in the ballot with John Kerry and George Bush, but in only the 5 cities that the hospital serves. It is supposed to be non-political, but as you know that when you run for an election, there is always political endorsement. And I was endorsed by the Democratic Party.
But are you a Democrat? Are you a Democrat otherwise?
Yeah, I'm a registered Democrat.
Okay.
In fact,
what is this Ellis Island Medal of Honor that you have won in 2007? I remember hearing it from you at that time, but I didn't really understand what the modalities was.
Ellis Island Medal of Honor is given to immigrants who have given outstanding contribution to this country. But having said this, immigrants,
not necessarily in the medical profession, not necessarily in the medical profession.
No. There are 7 American presidents who are recipients of this. The old George Bush, Clinton, Hillary.
Where is Ellis Island? Is it near Manhattan? You find a board, Ellis Island. Is that the one? Same?
The function, it's a very ceremonial function. The function was actually held in Ellis Island. It's a they put up a real big show. There are a few Indians who have got it. Sanjay Gupta, the CNN medical correspondent, right. He received it last year. But yes, I received that in 2007.
No other Malayali has got it.
Not at that time, and since then I don't know. But they have given to Muhammad Ali, they are given to Arthur Ashe, they are given to Rosa Parks. People, who have whom they think they've really given some contribution to this country.
Well, you are a product of Stanford and Berkeley and so on, so that's itself a big recognition. And we hope that you will come back. You will come back one day and serve Kerala.
More than anything else, I'm the product of Science School Trivandrum and Trivandrum Medical College, which is really my alma mater, and of course Mariwanius College, where we first met. And so I'm proud to say that I've gone through all these institutions. And
well, they are based in Kerala also. It's not that they are the one. They are not the best. Anyway, thank you very much for spending some time with me, and also at this time of the day. Here it's already night, but there is daytime, I think. And
that's right. I'm just I just got to run to work now. Yeah.
All right. Thank you very much. I think you gave us a lot of ideas, insights into the situation. Nobody knows for sure what's going to happen, but whatever happens, it's important for us to decipher or decode what is going on in the world, and that way you helped us. Thank you very much.
Thank you. And let's hope for the best, and God bless.
Thank you.
Thank you.